What are diuretics used for in ascites? Fluid retention. Imagine feeling like your abdomen is swollen and heavy, making everyday activities uncomfortable. That's often what happens with ascites, which is when excess fluid builds up in the belly. In many cases, especially when liver cirrhosis is involved, doctors turn to diuretics to help manage this condition. But what exactly do these medications do, and how do they work? Diuretics are medicines that help your kidneys remove extra salt and water from your body. When someone has ascites, their body is holding onto more fluid than it should, often because of liver problems. The main goal of diuretics in this situation is to encourage the body to excrete more sodium and water, reducing the amount of fluid in the abdomen. This helps decrease swelling and makes breathing easier. The first medication usually prescribed is called spironolactone. It's a special type of diuretic known as an aldosterone antagonist. It works by blocking a hormone called aldosterone, which causes the kidneys to retain sodium and water. By blocking this hormone, spironolactone helps the body get rid of excess fluid while keeping potassium levels balanced. Doctors often start with a moderate dose, around 50 milligrams daily, and may increase it gradually based on how the patient responds. If spironolactone alone isn't enough, doctors might add a loop diuretic like furosemide. Loop diuretics act on a different part of the kidney to increase the excretion of sodium and water more aggressively. Combining these two types of diuretics can be very effective, but it requires careful monitoring to prevent side effects like electrolyte imbalances or kidney issues. The key to successful diuretic therapy is creating a negative sodium balance. That means the body is losing more sodium than it takes in. This gradual process helps reduce the fluid buildup without causing dehydration or other complications. Alongside medication, doctors usually recommend dietary sodium restriction, often less than 2 to 3 grams per day, to boost the effectiveness of diuretics. Monitoring is very important during treatment. Regular checks of kidney function and electrolyte levels help catch any problems early. Sometimes, fluid intake may also be limited to help control fluid levels. In severe cases where diuretics don't work or cause too many side effects, procedures like paracentesis, which involves draining fluid directly from the abdomen, might be performed. After that, medications are used to prevent the fluid from coming back. In the context of liver health and liver cancer, managing ascites with diuretics is a vital part of supportive care. It helps improve quality of life by reducing discomfort and preventing further complications from fluid overload. But it's always important to remember that these treatments should be guided by healthcare professionals, as each patient's situation is unique. To sum up, diuretics are used in ascites to help the body get rid of excess sodium and water, easing abdominal swelling and improving comfort. Spironolactone is usually the first choice, with loop diuretics added if needed. This approach, combined with sodium restriction and careful monitoring, helps manage the condition safely and effectively. Always consult a healthcare provider for personalized advice and treatment options.